Welcome back to Homeo Vision and a very good day to all of you. In this video of Organon of Medicine series, let us have a look at the aphorism number 5, and as a continuation of this aphorism, let us also learn about the causes of diseases. Let us read the aphorism first. Useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of the chronic disease, to enable him to discover the fundamental cause, which is generally due to a chronic miasm. In these investigations, the ascertainable physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual function, etc., are to be taken into consideration. A highlight point for this paragraph is that the fifth aphorism was first introduced in the fourth edition of Organon. So this aphorism first came out in the fourth edition of Organon, and in this aphorism, we can see that Hahnemann is talking about acute diseases, chronic diseases, exciting causes, and fundamental causes. So therefore, through this paragraph, he is giving us a concise idea of case taking, and not only that, he is also pointing out the important things that we have to elicit in the case taking of an acute and a chronic disease. In the first sentence, Hahnemann is trying to talk about exciting causes and acute diseases and fundamental causes and chronic diseases. So through this sentence, we will get to know that in acute diseases, if we are able to identify the exciting causes, these exciting causes will help us in treating the acute disease of the patient. Further, he also says that after the elaborate case taking of a patient suffering from a chronic disease, if we are able to identify or if we are able to discover the fundamental cause, this fundamental cause will again assist or help the physician in treating the chronic disease that the patient is suffering from. Further ahead, he says that if it is a chronic disease, usually the fundamental cause is going to be a chronic miasm. And we can identify the chronic miasm through the detailed case taking that we do in cases of a patient suffering from chronic diseases. So further ahead, he talks about the points that we will have to elicit or the points that we will have to cover while doing a case taking of a chronic disease. So he says that especially when the disease is chronic, we will have to ascertain or we will have to elicit and identify the physical constitution of a patient. We will have to elicit the physical constitution of a patient. We will also have to uh, elicit his moral and intellectual character, his occupation. We will have to ask about his occupation, his mode of living, his habits, his social and domestic relations, not only that, his age and sexual functions. So, in a chronic disease case taking, all these accessory circumstances, that is, the constitution of the patient, the moral and intellectual character, his occupation, mode of living, habits, social relations, domestic relations, sexual function, and his age. All of this is going to be very important in the case taking of a chronic disease. And through all these points, one will be able to identify the fundamental cause of the chronic disease that this patient is suffering from. So, this is a very brief gist of the aphorism number 5. Okay, so as already discussed earlier, at the end of a detailed case taking in a chronic disease, the physician will now be able to discover the fundamental cause, which is going to be, so the fundamental cause, which is usually a chronic miasm, which is a miasm. So what are these miasms? So this miasm can be psora, psychosis, or syphilis. So at the end of the case taking of a chronic disease, the physician will now be able to ascertain or discover which miasm the patient belongs to. And once this discovery has been made, it will be easier for the physician to treat this patient. All right. Now let us talk about the three different causes of diseases. And these are, as you can see on the screen, exciting causes, fundamental causes, and maintaining causes. Let us understand what these causes mean. The first one is exciting cause. We will learn more about exciting cause in aphorism number 73. So when we come to that, we will learn about the different types of exciting causes and the importance of exciting causes. But for now, let us understand what an exciting cause means. So as simple as it sounds, an exciting cause is a cause that excites a disease condition, which means it is a cause that triggers some suffering in a particular individual. Now, let us understand this with an example. Say we have a patient who comes to us and says that after drenching in the rain for a considerable amount of time, he is now suffering from coryza, that is, he is now suffering from cold. So, here the drenching in the rain, okay, getting wet in the rain or drenching in the rain can be taken as the exciting cause. So, drenching in the rain led him to catch a cold. So, here drenching in the rain becomes the exciting cause. So, it is a very simple cause that has excited coryza or cold in this particular individual. So, this is what an exciting cause is. For more examples, for say we have a patient who comes to us saying after walking in the sun for a very long time, that is after prolonged exposure to heat or excessive exposure to heat, he started having a headache. So here, exposure to heat or exposure to excessive heat can be taken as the exciting cause. We can also have another patient coming to us and saying that after having ice creams, cold drinks, and also after being exposed to a lot of cold air, he has he has ended up having coryza and cough. So here again, exposure to excessive cold can be taken as an exciting cause. There's also one more important thing that we'll have to know about an exciting cause. It is that an exciting cause can cause an indisposition. We will talk about indispositions later, but for now, just know this that an exciting cause can cause an indisposition. It can cause an acute suffering, that is, an acute disease. Exciting causes can also cause an acute suffering in a chronic case. Acute suffering in a chronic case, and this is usually and popularly called as acute exacerbation of a chronic disease. So as told earlier, we will be discussing about all these types of exciting causes, the importance, and what all the exciting causes can cause in aphorism number 73. But for now, we have to know that eliciting an exciting cause, such as drenching in the rain, having cold food, or getting exposed to excessive heat, these are all exciting causes, and eliciting these exciting causes can become very important in the selection of a remedy in acute cases. Okay, one more high yield point that we have to know about exciting causes is that the exciting cause cannot cause a disease or the exciting cause cannot cause a suffering without the presence or without the influence of an underlying miasm in an individual. So, what this means is that only if the person is susceptible to being affected by a particular exciting cause, only then can this exciting cause bring about a disease or a suffering in this particular individual. And how is this predisposition or how is this person made susceptible to a particular cause, say excessive heat or excessive exposure to cold? How is he made liable to this particular cold or excessive heat? That is because of the presence of an underlying miasm. Say, for example, psora. So, only if there's an underlying miasm like psora, this can make a person very sensitive to cold, and the slightest exposure to cold air or draft of cold air can make him end up with a cold or a cough. The next cause that we have to discuss about is the fundamental cause. Now, the fundamental cause is nothing but the chronic miasms. And as already discussed earlier, the chronic miasms are psora, psychosis, and syphilis. Again, as discussed earlier, we said that only if there is an underlying miasm present, only then can an exciting cause bring about a suffering in this person. So as you can see, only if there is this fundamental cause, only if there is an underlying miasm, only if there is sora, psychosis, or syphilis present in an individual, only then can any cause take an effect in that particular individual. So this is one of the reasons again why fundamental cause that is sorry I'm sorry this is why chronic miasms are called as fundamental causes. So only in the presence of chronic miasms can a person suffer from a disease. This is all that we have to know under this aphorism. But yes, also much more importantly, fundamental causes are the causes that bring about, or these are the causes that are responsible for the development of true natural chronic diseases. It is true natural chronic diseases. Let us emphasize on this word here. We will learn the importance of this word in the upcoming aphorisms. So far we know that exciting causes mainly are responsible for acute diseases, and fundamental causes, that is the chronic miasms, are mainly responsible for true natural chronic diseases. Now, what are maintaining causes? Maintaining causes, there's a very popular phrase to define maintaining cause, and that is avoidable noxious influence. So, maintaining causes are popularly defined as avoidable noxious influence. Let us break this up. Avoidable meaning something that can be prevented, and this kind of a cause is in the hands of the patient himself. So, avoidable, noxious meaning dangerous or harmful. Influence here is nothing but the situation or the cause. So, maintaining causes are called as avoidable noxious influences, and these are responsible for the development of something called as a pseudo-chronic disease. Pseudo again meaning false. So, in the previous section, we saw that fundamental causes are responsible for true chronic diseases, and here maintaining causes are responsible for false chronic diseases or pseudo-chronic diseases. Okay, now let us take an example to understand this maintaining cause better. Say we have a tobacco smoker who is suffering with persistent cough. So here smoking is the maintaining cause, meaning smoking is maintaining the disease, that is the persistent cough over here. So as long as this individual is smoking, he will continue to suffer with this cough. So the moment you cut off the smoking, so if we tell him to stop smoking, his cough will also become better, his disease will disappear. So that is why maintaining causes are called as avoidable noxious influences. Also, let us take another example, malnutrition. Malnutrition here, what is happening in this case? The insufficient nutrition is considered as the maintaining cause. So if you correct the diet of this particular individual, all his symptoms will improve. His malnutrition will cease to exist. So maintaining cause is something that is avoidable. As long as the maintaining cause is there, the chronic disease or the so-called chronic disease will exist. That is why this is called as a false chronic disease or a pseudo-chronic disease. The moment we eliminate this maintaining cause, we can eliminate the chronic disease as well. So these are the three causes in uh, in very brief. We will we shall end this video over here. If there are any doubts, please do put them up in the comment section below. Also, like and subscribe for more content. Thank you.